My special guest today is Romlie Mokak, who is the CEO of the Lowitja Institute here in Melbourne. Thank you for your time, Romlie.
Thanks, Cate.
You've written a piece for our next edition of the MJA on the collaboration between Lowitja Institute and the Lancet. Can you tell us a bit about that, please?
Yeah, sure. So the Lancet Lowitja Institute collaboration looked at Indigenous peoples across the world. So half the Indigenous peoples of the world were covered by the study. The study was led by Ian Anderson, who's an Aboriginal researcher at Melbourne University.
Yep.
So big collaboration. There are, I think, a couple of stories in this. One is that this is a groundbreaking piece of work in terms of looking at how Indigenous peoples of the world are faring against benchmark populations, so the broader population. And I think the second, which is also really important, is the Lowitja Institute, being a small Aboriginal Torres Strait Islander organisation, collaborating with the Lancet, a major journal known the world over. So that's an important story for Aboriginal Australia as well.
Yeah, absolutely.
The report itself, not in some ways not surprisingly, Indigenous peoples the world over are behind the benchmark populations. But there are a couple of things that are quite interesting in that in some places the Indigenous peoples are not are actually not far behind or equal to the benchmark population. So there's a question around what's going on there.
Right.
We know from some of the Sami populations that in northern Scandinavia that their life expectancy difference as well is not there's no difference there.
Right.
However, when you look at wealthy countries like Australia, there's no guarantee that the wealthier countries will have a smaller gap.
Right.
So this is a question of equity, and all Australians, all researchers, all policymakers should be concerned about equity. So, in a number of developing countries, the life expectancy was lower than ours as Indigenous peoples here, but the gap was on par.
Right.
So they're pretty important things to consider. In these first world countries, still see a persistent gap between Indigenous peoples. So if you take an approach which we at the Lowitja Institute are wanting to change this sort of thinking, this mindset about Indigenous peoples always being deficit laden, always viewed through a negative prism. So we're wanting to change that because we know that things like culture and strong culture, strong identities, understanding who we are as Indigenous peoples, are protective and empowering. So if you look at the Closing the Gap campaign, for example, which has been, it's an overwhelming piece of work over, more than 10 years.
Yeah.
200,000+ supporters, government signed up left, right and centre to the overarching objectives. But we're still having difficulty closing the gap. So what we know from the evidence is that the more control, the more agency, the more empowered people are, whether they're black or whether they're from migrant backgrounds or wherever, we know that you're going to have better outcomes. So the big challenges ahead are really about allowing, not that we're permission seeking, but actually bringing Aboriginal people from the margins into the centre of our world, and giving us the responsibility that so often gets talked about in a negative discourse.
Yeah.
Allowing us to lead, and we will step up to that. We're not asking permission for that, and this is really what the Lowitja Institute will be here to serve our people into the future on. Quite simply, that question about placing Indigenous peoples first. We have to be able to, and this isn't unique to medicine. You could be doctors, it could be lawyers, accountants, engineers,
Yep.
the whole, whole grab bag of professions. But our kids need to know that those professions are open to them.
Yeah.
For one, so strengthening the pathway and the pipeline into those professions is fundamental.
Yep.
So getting universities, for example, to go beyond, their walls and actually participate in their communities within which they're resident.
Yeah.
Simple as that.
Yep.
And going beyond that, doing outreach to smaller communities. So a kind of a familiarisation of kids to medical schools is really important. Seeing Indigenous doctors and medical students, knowing that they can achieve that, because these people are just like their uncles, aunties, cousins.
Yep.
And I'm intentionally not using the word role model, because I think that kind of places this in a value system that should be much more about saying Aboriginal kids can achieve whatever they want.
Mm-hmm.
And look at this, we've got blackfellas in those jobs already.
Yep.
You don't have to be a role model.
You just have to be visible.
You just have to, and that therein lies the difficulty, is that the numbers are still so small. Only 200 doctors, 350 plus students, which is a major achievement, but still a long way to go.
Yeah.
What we want to do here at the Lowitja Institute is to build the next generation of, in our kind of vernacular, deadly Aboriginal. Well, they don't have to be Aboriginal. The Aboriginal should not be the descriptor.
Yeah.
We want deadly health researchers, able to mix it with the best of them.
Yeah.
And through this place, we're supporting a whole bunch of PhDs, masters, and we support a program around at a certificate 4 level.
Yeah.
So these are Aboriginal people working in health services or public health areas or policy areas who want to know a bit more about research.
Yeah.
So we're supporting that work. We also support in one jurisdiction a medical research institute to both go out as outreach to some isolated remote schools and to also come down into the metropolitan hub of that institute. Now we're limited in our capacity, but you can see that along that pipeline that I kind of talked about in terms of medicine, we're doing the same in health research.
Mm-hmm.
And I've got every confidence that in the same way that we've seen, Aboriginal and Torres Strait Islander people as leaders in nursing or leaders in medicine, that we are and we'll see plenty more Indigenous people as leaders in health research. But if there are kids that are interested in medicine, and I know GPs are flat out, but take an interest.
Yeah.
There may not be an Aboriginal doctor there to have that conversation, to spark that interest in the child. And there are multiple opportunities for that. It's planting the seed early, and it doesn't have to be an Aboriginal person to plant the seed.
Yeah.
A local GP is a resource for the community. So in terms of practice, I think that there are some things that ought to be that are often not the case.
Mm.
So one, a fundamental thing is for a GP to know who is Aboriginal in their practice.
Yeah.
It's not an option to say or to believe that someone might look Aboriginal, or I won't ask the question because I'm frightened that I might offend.
Mm.
When good practice is about asking the question around Aboriginality to all patients. So some of that, which requires not only some learnings and understandings, but also just the implementation of guidelines.
Yeah.
And the other thing that I would think is, have a relationship with your Aboriginal community. Get to know people. Don't just be a service provider.
Yeah.
That's an obvious connect, but there are any number of things that can draw people into the Aboriginal embrace, if you like. And it might be as simple as attending a NAIDOC function.
Yeah.
And the purpose of the Institute is a very simple proposition, and it is, and it at times takes a bit of mulling over what it might be, but the purpose is to value the health and well-being of Aboriginal and Torres Strait Islander people.
Yeah.
So it's a question of value, and you might sort of suggest, you might kind of think that implicit in that is perhaps an undervaluing or a devaluing. So we want to really talk about this and understand it. So the question of value is fundamental to our interactions, the wider nation's interactions with Aboriginal people, Torres Strait Islander people. This might be a kind of big constitutional recognition discussion, but it's also at the interface between the receptionist in a GP practice and that Aboriginal person walking through the door. So this is the stuff that we want to be really clear about going forward. What are the things that will impact for the benefit of Aboriginal and Torres Strait Islander people? And how are we clear about that conversation and the work that we engage in from the start? Where's the Indigenous leadership in research? How do Indigenous priorities get identified and serviced and met? Where is the capacity development for Indigenous researchers, for example? Where's the knowledge transfer, exchange between Indigenous communities and researchers? Where's the impact? And by impact, we're looking clearly towards benefit in a positive way, because we know that there are a huge number of negative impacts, and policies that continue to knowingly negatively impact on Aboriginal people, Torres Strait Islander people. The second thing that I'll say is that we, if you're, it's not really a readership, is it? If your viewers, want to have a piece of the action and just hang out with us between the 8th and 10th of November here in Melbourne, we are having our first Lowitja Institute International Indigenous Health and Wellbeing Conference. And the conference themes are identity, knowledge, strength. And I'd invite all of your viewership to come and join us.
Thank you so much for your time.
Thank you.